Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Catholic Health Services to help you sort through what's going on with COVID-19 in our communities and across the region, and we always want to hear from you. This is a call-in show. We want you to call in. The number's right there at the bottom of your screen, 516-393-1800. Let's get to the numbers right now. Governor Cuomo is refuting President Trump's claims that he has absolute authority over when states will reopen their economies. He insists he doesn't want to fight with the president, but would rather work with him as partners in figuring out a plan on how to restart the economy together. Now, as you can see the numbers right there on your screen, New York surpassing 200,000 positive COVID-19 cases. The governor saying today we could be at the apex, but it's still too early to tell. Nassau cases are still on the rise, more than 25,000 infected in the county. Nassau Executive Curran says the good news is more people are walking out of hospitals than walking in. And Suffolk not too far behind, more than 22,000 cases. This afternoon, Suffolk Executive Steve Bellone says he is cautiously optimistic as the numbers seem to be flattening. That's that plateau. Now, 778 new deaths overnight. That brings the state's mounting death toll to more than 10,000, almost 11,000 there. Nassau County has reached another grim milestone, more than 1,000 lives claimed by this deadly virus. The total deaths in Suffolk County reaching more than 600 today. Now, the check is not in the mail, but it may be in your bank account. So more than 80 million Americans should have those stimulus checks we told you about directly deposited into your bank accounts by Wednesday. That is if you have signed up and have that with the IRS. That's according to the U.S. Treasury Secretary. Grocery store owners and union officials are also calling out careless customers, those not wearing masks or gloves while shopping. The food union launched a Shop Smart campaign to help stop the spread of the virus. The campaign asks customers to pledge to wear masks and gloves while shopping, keep our grocery store workers safe, and keep 6 feet away from others, and dispose of the used masks and gloves in garbage cans. Don't leave them on the shopping carts or on the grounds outside. And today, Northwell Health nurses welcomed 46 cross-country nurses who've traveled from all across the nation to help serve on the front lines of the COVID-19 pandemic. The cross-country nurses will provide relief for Northwell nurses who have been working around the clock treating those patients since the outbreak began. Now, the pandemic is hitting the East End's greenhouse and flower operations also pretty hard financially. Easter, a total loss. Now Mother's Day, maybe a bust as well. That's where 80% of their business comes in May alone. Now, the same floors we spoke to told us he donated thousands of leftover Easter flowers to well-deserving nurses at the hospitals across Long Island. All right, let's get right to our discussion. Joining us tonight is Dr. Jason Golbin, Senior Vice President and Chief Quality Officer at Catholic Health Services. Thank you so much for taking the time. It always amazes me every night. We ask you to come on, and you guys work these crazy hours, and then you come back on and do this public service with us, so we appreciate that. Let me start off by asking you, how are you doing, and how are your colleagues doing right now?
Well, thank you so much, Stone. First, let me say it's a pleasure and an honor to be here. We think it's really critical to share with the public all the work that's being done and to hear from the public and try to answer those questions. So we very much appreciate this time. We are busy, but we are doing well. The team is strong. The nurses, the doctors, the therapists, the behind the scenes people, everybody is working and driving and rowing in the same direction so that we could provide care to our patients in need. So it's hard. It's a daily battle, but as we like to say, we're blocking and tackling, and we're pushing towards the end zone.
Okay. Now, I've been hearing just from conversations I've been having that I know the hospitals were asked to go up to about 100% capacity, and even more than that. And they're getting down. We may be at that plateau, but it's still about 110% at some places. How are your facilities holding up?
Absolutely. We've pushed in many ways. Certainly, critical care coverage, where we put, unfortunately, our sickest patients have expanded far beyond the 100% level, and we have asked our staff to help staff those beds and to take care of those sick patients, and then doing it in different locations all over the hospital. We like to say, the care doesn't, it's not about where you are. We bring the care that's needed to you. So we have changed other floors into ICU level care, where we have the ICU level resources, the ICU level expertise, and we're providing that care all across the hospital. So we have far exceeded our 100% coverage, especially when it comes to critical care as well.
Okay, let's go some of the viewer questions right now. Bernita from Patchogue. Bernita, you there?
Yes, I'm here.
What's your question tonight?
Okay. I have 4 of the 5 underlying conditions, and the worst is a lung disease. I live in an apartment complex approximately 5 to 7 minutes from a hospital that has refrigerated trucks which hold dead bodies. My question is it safe to open the windows in my apartment? Because I'm afraid because of all the dead bodies, there are a lot of toxic fumes coming from these bodies, which would be in the air. Is it safe?
That's an interesting question. I have to say, I haven't. There is certainly no data to say that it's not safe. Fresh air is good as long as there's nobody sick around you. We know that this disease is really spread by droplets when you cough or sneeze, and then you touch it with your hands and you touch your face, or somebody unfortunately sneezes on you. There is really minimal airborne spread unless we're doing a procedure in which we exhale gases out of the lungs, and that would really be stuff you see in the hospital, not stuff on the outside. There is certainly no data to think that that unfortunately these patients that have passed away would be spreading it through the air. So I see no reason why you shouldn't get a little fresh air in the apartment, as long as there's not too much dust or other pollens in the air that are bothering you, as long as you don't have allergies.
Okay. Let's go to Dee from Ronkonkoma. Dee?
Yes, hi. My question is, if the schools decide to open back up for this year, for these last 2 or 3 months, if you have a child with an autoimmune issue, do you think that it's safe to send the child back, or should the child sit the rest of the year out?
Oh, that's a great question. So I'm not sure what they're going to do with the schools. I think that's a fair concern, whether your child has an autoimmune disease or not. I am confident, however, that the leadership of the state, of the city, of Nassau, of Suffolk, would, if they do open the schools, will make sure it's as safe as possible for our students. However, given the underlying condition of your child, when and if the decision is made to open schools, I think there's no harm in asking, say, are there any special precautions at that time that need to be put in place for my child, because they do have an underlying condition which may put them at risk of not just COVID, but unfortunately many diseases. So I hope that answers your question. I'm confident that when and if the schools open, they should have taken this, the government certainly should have taken this into account.
Yeah. And that may not be an issue, given what the governor's been saying recently. Let's go to Lisa from Seaford. Lisa?
Hi, how are you?
How are you? What's your question tonight?
I'm good, thank you. How does one tell the difference between seasonal allergies and COVID symptoms, since they are a little similar?
No, that's such a great question. It's difficult, right? It depends on what you're feeling. So if you are having fever, that would be one of the signs that would think I'm leaning more towards something outside of the seasonal allergy range. Seasonal allergies will give you cough, runny nose, sputum production, watery eyes, but typically do not give fever. However, if you have a known exposure or something else to suggest that you could have been exposed to COVID, you have to think about it in what we call the differential diagnosis. You know, here's my symptoms. What could this be? If you have aches, chills, those are more atypical, not typical for seasonal allergies, and I would lean towards that. But it certainly presents a dilemma. We're actually seeing this brought up in the medical literature as well, that because we're entering into the allergy season, that this may be a dilemma for doctors to figure out. So ultimately, if you are concerned, there is no harm in reaching out to your physician, your care provider, and having a call, having an e-health visit, a telehealth visit. There's no downside to that.
Okay. Let's try to get Maritza from Baldwin in.
Yes. Hi. Good evening.
Oh, we may have lost Maritza. Are you still there? Maritza? Maybe Denise from Plainview. Denise, are you there? We'll try to get Maritza back.
Yes, I am.
What's your question tonight?
It's a two-part question. The first one is once you've been exposed to the virus, how many days after would you start to feel symptoms? And the second question is I've heard that sometimes patients, after they have the virus, like 6 to 8 days into it, start to develop respiratory problems. Is this true?
So let's take those questions. I think the first question was, how long do the symptoms last? What we're seeing typically, and not everybody is typical, is that this could range from anywhere between 3 days if you have a very mild version, all the way out to 21 days. We're seeing people's symptoms really continue out to that second and third week. But we do know that if I had to pick the course that worries me the most, it is that sometimes we see somewhere between days 6 and 10 that the degree of respiratory distress, of breathing difficulty, breathing challenges, starts to pick up and become a bigger issue in that time period. We don't know why it is. Some hypotheses are around that as the body builds its immune response, we start to see that immune response manifest in the lungs. We don't know. But the answer to your question is that, yes, we are seeing that, and that will be a symptom that would certainly give me pause to, if you are not in touch with your doctor, to reach out with your doctor. And if you are in touch with your doctor, to flag it and say, hey, I'm having more shortness of breath. I can't, it's difficult to walk to the bathroom. These are the symptoms that I would really be worried about.
And doctor, how long from the time you're exposed to the time that you might start showing symptoms?
Yeah, so again, great question. So it could be, the incubation time where it's manifesting in your body could be anywhere between 3 or 4 all the way out to 14 days. We don't know. The average appears to be about 5 or 7 days, and the challenge is that in the period right before the symptoms start, that there is a possibility that you could be contagious. There was actually a paper that just came out from New York, from a hospital in New York, where they looked at their.
Doctor, I'm gonna let you hold that thought right now. We're gonna take a quick break, and then I'm gonna let you finish that thought right after this. We're gonna be right back with more of your questions. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Jason Golbin, Senior Vice President and Chief Quality Officer at Catholic Health Services. Again, thank you for your time tonight. And before the break, you were actually answering my follow-up question on the time that it takes from the actual exposure to when you're starting to develop symptoms. I cut you off in the middle of that. I'll let you finish your thought.
No worries. And I appreciate the opportunity to be here again. So just to note, there was a paper that just came out, published in the New England Journal, that talked about exposures in patients that were asymptomatic, and they found a large percentage of patients that were asymptomatic that were tested were actually positive for the disease, which makes it challenging, and maybe one of the reasons we're seeing, or we have seen, such a rampant spread in a geographically dense area like New York.
Okay. Let's go back to the phone lines. Michelle from Massapequa. Michelle?
Hi, how are you?
I'm great. What's your question tonight?
My question is, my husband and I are seniors. I'm going to be 70. My husband is 73. We're in fairly good health and have no underlying conditions, but we argue all the time about whether we should go to the grocery store or not. How bad is that for us to be going out to the store?
I'm chuckling because my parents are just a touch older than you, and we fight daily about this exact topic. They're relatively healthy, just a little older, and my mom is going stir crazy, as she likes to put it. But as much as possible, certainly while we're really in the peak of the disease, I would encourage you to stay home and socially isolate. Use delivery services. I just found an online meat delivery service, an alternative one, and sent both my parents and my little brother some meat to keep them from going to the store. So if I could give you I would implore, like I implore to my own parents, stay home, stay healthy. Let's get through this and use online shopping tools.
Yeah, great advice. Let's go back to, I think we have Maritza back from Baldwin. Maritza?
Yes, hi, good evening, doctor. Thank you and your whole team for all the hard work that you're putting in. My question for this evening is regarding the efficacy of the testing, particularly about surrounding negative results.
It's a great question. I will share that me personally, I had symptoms and tested negative, and hard to explain, the negative test with my symptomatology. So the test should be relatively sensitive and specific, meaning good at ruling in and ruling out the disease. Unfortunately, what we're seeing, and this is more anecdotal because it's hard to tell if your test was negative and you had symptoms, does that mean you were really positive, or did you have something else that may be going around? But anecdotally, we are seeing a decent percentage of patients that have symptoms yet have a negative test. Nobody's been able to quantify what that is exactly. And my advice would be if you had a negative test, if you have symptoms, you should isolate, you should protect anybody who may be vulnerable around you until those symptoms pass. So I hope that answers your question.
And doctor, let me get you to comment. I know that you real quickly, if you could talk to us about the new trials that you're working with.
Great. As you know, there is no proven treatment for this disease, unfortunately, and that's really one of the most frustrating things about this disease. But I'm pleased to note that CHS has kicked off two new trials within our system. One is we are part of the Mayo Clinic National Convalescent Plasma Study, in which if you've had the disease with a positive test, you have 14 days of no symptoms, you can donate your blood, your plasma, through the New York Blood Center, and then we're eligible to obtain that blood and as part of the trial, transfuse it into our sicker patients to see if there would be possibly transmission of antibodies against the disease, thereby helping to knock it out in our sicker patients. The other study we are part of is under one of the pharmaceutical companies, Gilead, who have a novel antiviral drug called remdesivir, that we were able to be part of their expanded use study starting actually today, which is great news, and I'm happy to share that. Again, for a subset of sick patients, this may be an option. Neither of these are proven treatments, but given that we have no proven treatment, we like having more tools in our tool belt to fight this difficult disease.
Okay, and are we looking for these to be developed anytime soon, or how long?
Oh, they started. Mayo is really giving and looking to make sure, is there any effect, and are there any adverse effects? We don't think so. It's relatively benign. And the remdesivir, which is the drug therapy, is also starting today, and that's looking same thing. Is it efficacious? Does it work? And we want to make sure that it doesn't cause any harm in our patients.
Okay. Well, we ran out of time. I just want to say thank you again for everything you're doing. You guys really are the heroes on the front lines. Dr. Golbin, thank you so much for your time.
Thank you, Stone. It's been a pleasure.
Well, thank you very much. And thank you for your calls. We'll be back tomorrow night at 7. Join us then.